here we are. We are here for another episode of the Wading Through the Waters podcast. My name is Josh, and I'm here with Britney. How are you today?
I'm good, thanks.
Good. It's good to have you, and I'm excited to get into a conversation. I know we have a lot of these conversations over lunch and, just in passing, and, the whole office as well does that. And it's just interesting to hear those conversations and to get into different topics and learn new things. I mean, just, again, someone who's outside of the mental health space, with all your expertise and knowledge and wisdom, I love to hear it. So that's why we started this podcast. And so I'm excited to have a conversation with you. And this podcast is designed to help people wade through the waters of life and navigate a difficult mental health system. And so, I hope you are excited for what we're going to get into. We've got EMDR, we've got your background, and lots of different topics that we can talk about, and wherever we go, it'll be fun, I'm sure. So first of all, I want to get a little background on you and learn about who Britney is, how you got to where you are, and just talk about the path that you've taken to get here. So first, let's just dive into the little bit of the personal background. Where'd you grow up? What was your life like? And then we can get into maybe some of the professional aspect of it.
Okay. Yeah, ready for this. So grew up in Elizabeth City and tried to leave a couple of times, and both times my grandfather would call and start crying, and I'd end up back here. And so ended up just back here because of family.
Okay.
I used to joke with my grandfather and tell him when he kicked the bucket, I was going to be out.
Yeah.
And then the joke was kind of on me, because I ended up with shared custody of my sons and couldn't leave. So, that was his way of laughing back at, my best laid plans. Yeah. And so, my boys have grown up here, and I grew up here, and that's about,
Yeah. Okay, cool. So, and then now you did school online. Where did you go to school? And then how did you get into mental health?
That's a long one.
Yeah.
I was a high school dropout.
Okay.
That's something that a lot of people don't know about me.
Okay.
I dropped out the second or third week of junior year.
Wow. I would not have guessed that at all.
Yeah. I did not like school.
Wow.
I hated school. My mom had to drag me to school, kicking and screaming pretty much. But I was undiagnosed with ADHD. We didn't know that. I also, had a trauma history.
Yeah.
I had childhood trauma. And so I didn't want to go to school. Didn't like school. Didn't have meds. They didn't even know what it was back then.
Right.
I was born in 80. So
Yeah.
Here, they had no idea. I was in the gifted program. So it was always like, she's so smart. Why doesn't she do this? Or why can't you just? And, I'd test really well. And they're like, well, she has to be paying attention to some degree. But I didn't do my work because I didn't want to do my work.
Yeah.
And I couldn't do my work because I couldn't focus on my work. It was a pretty long journey, because I did drop out early, and I went to COA and finished my adult high school diploma program. Okay. They've got the adult high school and they've got the GED. And I went through and got my adult high school diploma. Well, I had no idea what I was going to do after that. None. So I decided to do it the backwards way and start a family first.
Okay.
I was young and I was stupid, and I wouldn't trade my kids for anything.
Sure.
But, I got married at 18. I had Seth right before, midway through 19. Wow. So I was a young mom. I had no clue what I was doing, like none. And then while I was pregnant with Seth, I took my first classes at COA for college. It was like, I didn't really know what I wanted to do. No clue. And that's pretty common for those of us with ADHD. We just, there's so many things, so many paths.
Right.
And to try to pick one is pretty much impossible. Notwithstanding the fact that we tend to be a good 2, 3 to 5 years behind developmentally, emotionally.
Okay.
So really, I was more like a 15, 16-year-old making those decisions.
Yeah.
I know that now. I wish I'd known that then. But I ended up at COA. I took my first classes. Psychology was one of my first classes, and I fell in love with it. I absolutely loved the class, but I ignored it because, of course, not medicated. Didn't know I had ADHD. And I was like, oh, but there are all these other things. I never really enjoyed as much.
Yeah.
But I kind of went away from that and then came back to it later. Once I finished my associate's degree, I actually did my associate's degree in theater education. I was like painfully shy. Like I really pretty much took on taking like the acting and the public speaking classes to get over that fear of being in front of people and that insecurity that came along with it. But then I, of course, after taking that class, I was like, whoa, I can do this whole program. And then I ended up doing all kinds of stuff.
Just kind of went down the rabbit hole.
Right. I went down the rabbit hole completely because I took like everything, technical, directing, acting, all of it, lighting, sound, set construction, and design. I ended up going down the rabbit hole completely, which is great. I got an associate's from that. Mm-hmm. But what are you going to do with that?
It's hard. I mean, it's a hard industry to get into, at the top.
And I had a kid. I was married. There wasn't really, what are you going to do with that? That was really more of a self-discovery, for me anyway. It was a fantastic journey of self-discovery and who I was, what I was capable of. Yeah. And, I was working, going to school full-time and taking care of my son. Because at that point, I was divorced by the time I was 21.
Okay.
Young. I knew him for 3 months before I got married. So what do you really expect out of that?
It's hard.
Again, not uncommon for ADHDers.
Right. Okay. Wow.
That are unmedicated and undiagnosed.
Yeah.
So, I was by myself, with my oldest and just kind of working, going to school and trying to figure things out. Then I found a program, because I went right back to psychology. Like after taking all that they had at COA for psychology and the sociology course, I really did like that. And I was like, well, that's something I can do something with. And I like it.
Right.
So I ended up, because there wasn't really anything at that time closer by, and I needed something where I could, be flexible as a mom and having to work. So I found a program, Liberty Online. Liberty University had an online program for multidisciplinary studies. So I could take my associate degree and put it into a bachelor's degree. So I'm not taking all the gen ed again. I can just take the psychology courses. So that's what I did. So I had a dual, it's like having a double major.
Okay.
I did the theater education and psychology.
Okay.
So that I had kind of a twofer. And then after that, I didn't know what I was going to do with it. And, I had married a second time at, 24. And then had my second child at 25. And now I'm a mom with 2 kids at home, finishing up my bachelor's degree.
Yeah.
And I'm like, well, what do I do, from here? And I initially wanted to go through and get my master's, but I'm glad I didn't. I needed to live my life a little bit. I don't think I would have been the same therapist as I am now if I had gone straight through and gone straight into.
Okay.
Because at this point, I was 28, I think, when I finished up everything and was getting ready to go on my master's program. And went through a lot with my marriage. And so after, 8, 9, almost 10 years in, was headed for divorce at, 32.
Right.
So at that point, I did a lot of things in between that. I'm 4 classes shy of another master's degree that I'll never finish from Regent.
Wow.
In directing cinema and television.
Okay.
Yeah, I'm not gonna go down that rabbit hole.
Yeah.
No point. But again, it's a study in human behavior. It's, kind of, it is related.
Yeah.
But when my ex-husband and I separated, that was the first thing I did was enroll in school. I was like, okay, it's time for me to do something for myself.
Yeah.
Because it had been largely about others in my life up until that point. And not about me. I hadn't really had that time to really invest in myself, discovering who I was, what I wanted, and putting that energy into me. It was always into, kids, husband, and so forth, other people. So that's the first thing I did. I enrolled not only in my master's program, but in nail tech school. Yeah. So I could work, have flexibility with the kids.
Okay.
And finish up school and go into a different path.
Yeah.
Now, I thought I would be like way behind everybody else in my cohort. And I did feel that way. It was like, man, I'm, 32, 33 years old. What have I done with my life? Who am I? Where am I at? Which is so common for women, especially those of us who start early. We all find ourselves at like, is this it? Is this all there is to life? I don't even, who am I? I don't even know if I like this. So, then I was doing something that I wanted to do. And when I first did, which is so funny because being a nail tech prepared me so much more than what I thought it ever would.
Okay.
I was like, I'm just a nail tech. Never said that again after my practicum. My first practicum that I did with Capella University, that's where I went for my master's. And they do not only coursework, but practicum experiences. They're intensives. They're like, 7 to 10 days somewhere else, daily, like all day long interacting and using the tools, practical application. So my first one, and I'm in there intimidated as I could be because there's all these people who worked in the field already.
Yeah.
I'm just a nail tech.
Yeah.
Quote, quote. So I went in, and because I was so comfortable with seeing people hour after hour, one after the next, every hour, someone new, and building relationships with them and attuning to them, it was like second nature.
Yeah, it came naturally.
It just came naturally. So while everybody else was like, struggling, actually, not everybody, but I'm watching all these other people struggle with it. And I was so much more comfortable than I ever thought I would be. That's kind of when I knew I was like, okay, I'm in the right.
Yeah. In your sweet spot of something you like and then something you feel like you're naturally good at.
Yeah, which kind of sucks because you have to go through all this. You have to pay for all this schooling before you ever get to really know. Well, it's like, well, I hope I like it.
Yeah, and the schooling, but also just the I'm sure there was a lot more to that, like you're talking about with your first marriage and your second marriage, being a single mom, all of that all that journey. The main thing that I'm taking away from this is you had a lot of self-discovery and a lot of self-awareness to get to where you are now.
Yeah.
And it was because of everything you went through that you were forced almost to kind of say, who am I and what do I like?
Growth doesn't happen in the comfortable places.
Yeah.
Ever. Growth requires pain. It requires getting uncomfortable.
Yeah.
Healing requires pain and getting uncomfortable.
That's
a part of the process. And, I talk to my clients about that all the time. It's like, I'm never going to promise you it's going to be painless.
Right.
I'm going to be very upfront. I'm never going to BS somebody and say, hey, this is going to be a painless experience. No, you have to go through it. You can't walk around it.
Yeah.
Now, how we do that is different based on the individual. But, if you really, truly want to grow and change and heal, you have to get uncomfortable. There has to be some pain involved. Otherwise, it just doesn't happen.
Yeah, it's true. And, I wanted to talk real quick. We have I want to talk about EMDR in a bit.
Okay.
But on that topic of your journey and self-awareness, I really wanted to dive in real quick about your self-awareness with ADHD and how you got to such a place. I mean, you just in literally this morning, I feel like I've learned new things about people with ADHD and people who may not know that they have ADHD or anything. So, was that later on in your journey? And what was that like to kind of discover that about yourself?
Well, both of my kids have it. My oldest just got. I just kind of helped him. He needs to go get someone to formally diagnose him. But I'm getting 2 different autism spectrum and ADHD. I'm getting specialties in. I'm specializing in those.
Okay.
And I started going through some of because I present very differently from both of my boys. Going through all that, and I'm like, I kind of think you got it too, kid. You just have it more like mine, which high functioning, yes, but presenting differently. My youngest man. So my first encounter with ADHD was my youngest. Now my youngest presented off the chain. God bless him. He's like the sweetest thing and always was the sweetest thing. But I used to hold his head like this, trying to say, okay, I need you to look at me. And he's like this, back and forth. Like, I just can't look at you. I can't look at you. Just can't sit still.
Yeah.
And so when he started school, now this is like, I couldn't go use the restroom without him getting out the back door.
Oh, yeah.
Like it was that quick. I had to put a latch at the top so he wouldn't go out and go look at the next door chickens. he jumped off the back of the coffee table onto the back of his brother's head and almost knocked his 2 front teeth out. He climbed the curtains to get to something I had over top of the window. This kid was everywhere.
Yeah.
So by school, I remember as a kid, feeling like I just couldn't sit still.
Yeah.
Like there was this energy flowing and I just had to get it out.
Yeah.
I didn't know what that was. I just figured I had a lot of energy.
Yeah.
I'd crawl underneath the pews at church, and get my rear end handed to me, because they didn't know what it was and didn't know how to deal with it.
That's what I was going to say. The conversation was
I think my parents, would feel pretty bad if, really actually if they knew that why I couldn't do it. And, it was really not developmentally appropriate to get my hiney.
Yeah.
So then with Ben, starting school, he was underneath the desk, on the floor, messing with stuff, and he had this first grade teacher that was very old school. Everybody sits in one spot all day long, and it was painful for him. She wouldn't even allow teacher's assistants in the room. This is first grade.
Wow.
She was something. So we ended up having him tested, and found out he had ADHD. So then there's this whole... There's a lot to that as a parent, and I feel so much for parents going through it because you feel helpless in a way. There's so much to learn, and there's so much to do to help them navigate a world that they were not meant to fit into. The neurodivergent versus neurotypical, it's very different in how people think. So my youngest, like I said, was presented a little bit differently.
Yeah. So it was just so obvious to you.
Oh gosh.
And then how did you started picking up on things about yourself, or? Well,
really, honestly, it wasn't until I started my master's program for counseling, because I was struggling so much to do the assignments. And I was like, what is going on? And then, I went and talked to my PCP, and we're talking about the genetic, predisposition for, and how it runs in families, and how it presents so much differently in females. And so after doing an assessment with me, we're like, okay, yep, all these things, like the daydreaming in school, and the not being able to complete, and I'd be here, there, and everywhere, and the difficulties in hierarchy and time management. I had to learn those things. I was forced to because of having to be a single parent. However, they didn't come naturally.
Yeah.
And so I just went through life doing the best I could with what I had. I just did what I could. And so it wasn't until I was like, okay, so this is what I'm looking at. And then I had to go deep diving on how it presents differently in females, and what am I looking at with myself? How is this different from my son? So it was really, my son having it, gave me an introduction to it, obviously. Right. And having him at 25, I didn't get formally diagnosed until 33.
Okay.
So that's a time span, to watch him through school and what he struggled with. And homework time was the worst.
Oh yeah.
It was just done. Your executive functioning is done. I'm going to tell you now, for me, going home and doing clinical notes is painful.
Oh yeah.
I get them done because I don't want them weighing on me the next day. And I know I'm just going to have to sit. I'm going to have to do my breathing exercises, get into that headspace, and get it done. There are days I don't, but they're few and far between, where I'm just like, yep, nope, not going to work. Go to the next. Yeah. But, it is a journey. I think some of us self-diagnose. Some of us are like, you got something going on here.
Yeah.
But it's harder for those of us on the higher functioning end of either spectrum, ADHD or ASD, because it's like, well, you get these things done, so, what's really wrong with you?
Right.
You can do it.
Right.
But they don't take into account how difficult it is to do it.
Right.
What are the processes to that? So, yeah. So all three of us in the house are high functioning ADHD. So it's been, it's funny because now I know why my oldest and I butt heads so much.
Yeah.
Because our functioning is very similar.
Yeah.
And so when I'm trying to get this point across, he's trying to get this point across. We're not understanding how each other is not getting to the same conclusion.
Right.
So it can, be be difficult. Plus there's, difficulty in emotional regulation. And he's just in his early 20s. It hasn't gotten there yet. Yeah. Really, our brains aren't done developing until about 28 years old, 26, 27, 28. Until that frontal lobe, which is the place that helps with executive functioning, gets done developing.
It's literally a physical development, not just I have to experience this. I mean, experiences help, and you can go through different things, but literally physically you're not there yet.
Really physically you've got the reptile brain, which is all instinct, and then you've got the mammalian brain, which is all emotion. Those are two of the things that are in control until that executive functioning, that prefrontal cortex is done developing.
Now, before we move on, I just want to ask, what are maybe some of your takeaways from that journey, and maybe some, you don't have to give advice, but just things that you've felt have been helpful for you in terms of ADHD, dealing with it in your household, trying to just process, even processing that acceptance of that. Is there anything that you would say would be most helpful for somebody who maybe suspects that their child has ADHD, maybe they suspect they have ADHD, they're not sure? What would you maybe say to somebody in that realm?
Expect a lot of mixed emotions. There's a grief process that goes along with it. There's a grief process that goes along with having a child on, either or ADHD or ASD, because I think you have these expectations of what their childhood and adulthood is going to look like, and it's not going to be that. It is going to be more difficult, and so you grieve that. You feel responsible, which you're not. These are biological changes, differences. Our brains literally are structured differently. It's a neurobiological difference. So there is no blame game here. There's nothing you ate, didn't do, none of that. So I think that's something that's normal, to know that you're human. That is a normal experience, to have that. Well, do I medicate? Do I not? That is a hard choice to make, and it's okay that you struggle with it. Same thing with finding out as an adult that you have it. You're going to go through the grief process. I went through a point, and I still do sometimes. It pops up every now and then, not like it did. It's just an irritation now. But, there's an anger that comes along with what you've missed. That if I had been diagnosed earlier, how much of my potential was wasted?
Wow.
How much could I have done differently had I been diagnosed and medicated? Because we know that medication, like it or not, is the most effective. A long-lasting stimulant, an extended release stimulant, is the most effective treatment for ADHD, hands down. Your quality of life, I thought about going off of it after I was done with my master's, and my quality of life is so much better on it that I won't. I mean, minimal side effects considering what I gain out of it. I'll take it. You have to go through the grief of, our lives are typically about 7 years shorter having ADHD. That we know that. So there's a lot that goes to that, and it's normal and human to feel those things and to feel some type of way about it, and to be a little ticked that you have to go through a world that wasn't meant for you, seeing things differently and not always fitting in the box and always feeling different. I always felt that way, and that's a normal experience. And feeling like we just don't fit in.
In that realm too, knowing that you're not alone, and that it is much more common than you may think. And like you talked about, it's a spectrum. There's a lot of people that are on that spectrum that maybe don't know it. Maybe are show signs on on the left hand side where it's not as pronounced, but still it can affect their lives in a way they don't even know. And so knowing that you're not alone, and knowing that there is treatment, there is things that you can understand more about yourself to help in that aspect. And so I think that's really helpful for people. I think people genuinely struggle with those things and don't know it, and kind of calling it out in a way and saying, look, these are really important things to understand. you find that it can help give people freedom and help people grow and change and
well, help put a label to it so that you don't feel like, there's something wrong with you.
Right.
Because you can't do it the same way that everybody else can. There's nothing wrong with you.
Yeah.
You just function differently. There's a book by Temple Grandin, Different Not Less, about the spectrum, but that's the same for anyone that's neurodivergent. You're just different. It's not less or more, or it's just completely different. It's like comparing apples to oranges. And that doesn't mean you can't manage symptoms. I go by like the 80-20 rule. Look, if you can manage your symptoms to where 80% of the time you're good to go and 20% of the time you still struggle with them, that's to be human. That's every person.
Yep.
So 80-20 is about as good as it's going to get.
Yeah.
For any human being on this planet, neurotypical, neurodivergent or not, we fail.
Yeah.
We don't get it right 100% of the time. And when we can put a name to it, we're like, okay, we're not a failure. We just function differently.
Yeah.
Because a lot of us go through life thinking that there's something wrong with us and why can't we just do it like everybody else? We're a failure. You internalize those things. Yeah. I'm just lazy. I'm just dumb. I'm just this. No, that's not true. And when we can understand that about ourselves and maybe do some work to kind of neutralize some of the messages that we internalized about ourselves. Yeah. Speaking of things like EMDR are really helpful for that. Then you can live your life to the fullest that it can be, and that's all any human can ask for.
Yeah. So EMDR, this is a specialty of yours, is that correct?
That's correct.
Okay. And so what did you do did you get certification? What was your what's your training in it, or are you just is it just something that you've studied a lot? You don't have a specific certification. What does that look like for you?
Okay, so a lot goes into that because I'm not just EMDR, but I'm complex trauma certified.
Okay.
So I'm a complex trauma certified professional, which means I work with complex trauma. All the parts work. I do EMDR, I do some brain spotting, I do flash technique. So with the EMDR, you have part 1 and part 2 training. You have the basics, and then you have the more advanced, and then you can go on beyond that and get other like specializations in it. And when you start, there's a certain script that you follow. You got your basic EMDR protocol, and it's the same across the board. I don't tend to do anything the normal way. We'll just put it that way. So when I get started, I'm like, then I noticed this. And I'm like, but, it didn't go far enough for me, especially dealing with more complex. And I think people think of trauma as, these big traumas, like assault and car accidents and near-death experiences and, major hospitalizations, things like that they think of as like major traumas, right? The big T's. But that's not quite how our brain works. I mean, the big T's, those are traumas, but a trauma can be anything that leaves a lasting like imprint on your mind, emotional and physical sensation. So you go back to attachment traumas, something like your mom had a difficult labor and delivery, you were separated at birth for a little while, or you were premature or whatever. Mom had a C-section. You don't really get as much connect time right at first when someone has a C-section. That attachment rupture can have lasting physical and emotional implications. Yeah. Okay. So that you don't really think of as like a trauma. It's just natural childbirth, whatever. It's a really long labor and delivery. Yeah, your body goes through a lot. Your body remembers everything you ever go through. And it does that to keep you safe. Your first and your drive is to stay alive.
Right.
Right. So that means that your mind wants to remember all the things that didn't feel good so you don't do it again.
Wow.
So all of those are imprinted most, at the brainstem spinal cord where those two, kind of connect. That's where our most primitive instincts are, our drives are. So you've got attachment traumas. Maybe mom or dad was mentally ill and couldn't give you what you needed. That's not a blame, but that does have an impact on, how we move in the world. Yeah. How safe do we feel? Some little butthead on the playground, 5th grade, says something nasty to you and you remember it for the rest of your life. You internalize it. That's a trauma. Yeah. We don't think about those things as traumas, but they are, and we're coming to know just how much, like childhood hospitalizations, even routine things, have an impact on how, we move through the world and how our bodies perceive danger versus safety. So, you're in a sterile environment at 3 years old, getting tonsils removed. You're being strapped to a table, because you can't stop crying. Nobody's comforting you. You're being separated from your family. Yeah. All those things. A 3-year-old can't make sense of that. Yeah. That is a trauma.
I want to just butt in real quick because I have my own personal story, and I don't often have these, is I got tested for allergies when I was younger. Mm-hmm. And the only thing I remember about that is we went into the office, and I laid down on my stomach, and they put the...
I can feel that.
Yeah, the things, and it shows which spots you're allergic to.
Right.
I don't remember anything but that it hurt and that it was traumatic to me. It was like, oh my gosh, yes. There's 20 needles.
When you think about it, do you feel something in your body?
Yeah, it's just oh gosh.
Then that's a trauma. Yeah. Then it's stuck. And that's when you would use something like EMDR. Wow. you can stay within your window of tolerance pretty well. You're not going to go too high, or too low, out of your window of tolerance. So I would use a straight EMDR, and then, it's out of your body.
Yeah. Now, okay, so let's back up just a little bit. Let's define EMDR.
Okay.
And just talk about in general, for the average person who has no idea, what is EMDR? We talked a little bit about why you use it, but what is it? And then one of the questions I wanted to ask is, what does it practically look like? So
okay, so eye movement desensitization and reprocessing. Okay. So using bilateral movements, which is your eyes moving back and forth. You can use tapping as well. You can use auditory. Okay. So as long as it's going back and forth, because then you're accessing left brain, right brain, left brain, right brain. So it's like pulling the parts of your brain together to focus on this one thing, right? So we're all here in the same room focusing on this one thing. We're not just leaving a part out because we want that to be integrated as well. So with EMDR, as long as there are no issues with eye movement, no issues with small window of tolerance, no heavy dissociation present in the person, because that would require other kinds of work. Mm-hmm. As long as it's straightforward, you would move your eyes back and forth I've got a little red ball on the end of a stick because I'm not going to wear my shoulder out. Uh-huh. Let's be honest. I'm a little older. My shoulder will hurt. And you follow that. So as you're following that, your brain is actually processing the physical and emotional sensations. So what I would have you do is, I want you to bring up that memory, and what is the image that represents the worst part of that memory? Uh-huh. So let's take the allergies for you. Okay. Yeah. So getting that, what was the worst part? Was it getting the needles put into your skin, or was it the sensation that itches afterwards? And I know what that discomfort is. Yeah. On your back when the things pop up. Yeah. So when you run it like a movie, what's the worst part of it for you?
Yeah, it has to be just the shock of probably the needles the amount of needles that was going in, and just the sheer needles are a scary thing for most people, I feel like. And so then it's there's 20, and it wasn't all of them stabbed, but I just remember thinking this big board of needles is going into my back. Just the thought of that, I think.
Okay, so let's put that as the image. The needles going into your back is the image. Yeah. I'm sure you feel body sensation. Yeah. So where do you feel it in your body?
I mean, it's my back, and I feel I feel breathing, where I'm
breathing changes.
My breathing is faster, and I'm that's literally.
What emotions do you feel?
Anxious.
Okay. What do you believe about yourself? I am not what?
I am probably
Let me give you some examples.
Yeah.
Okay, so it's going to be in 5 different realms. You've got 2 that are responsibility, like I should have done something or there's something wrong with me. So responsibility and action. Then there's control, like I don't have control. And then there's safety and vulnerability. And that's like I am or I'm not safe, or I'm vulnerable, I'm helpless. And then there's belonging. I don't belong. Your attachment drive. So is it going to be?
It's definitely the safety.
So I am not safe.
Feeling not safe.
Okay.
I'm not. Yeah, I don't think I've felt that in that moment.
Right, and at that point, you're activated. So we're getting to the negative thought about self that got coupled with that experience. That's what we carry with us.
Wow.
Right? You've got the body sensation, you've got the image that represents it, and you've got the emotion that goes with it.
Yeah.
So those are what you need to process with EMDR. Once you have those, then I get you to focus on that image and on the body sensation and on the negative thought, of self. I'm not safe. So I want you to keep that in mind while your eyes are moving back and forth.
Okay, so talk to me about the physical part, because you said that there's, we're not just talking. I mean, and that was already helpful. Just even calling out what I was feeling and everything, that was already helpful to me on something that happened when I was probably 6 or 7, I think.
And 0 to 10, like how bad does it feel thinking about it now?
Not as bad, because I feel a little bit more power over it. You know.
So what do you think it would have been starting out before? If you were to think back on it, 0 to 10, how?
0 to 10, I'd probably say like an 8.
Okay. So that's a pretty high one.
Yeah, I think when I think back on it, I've always thought that was really scary. Like I really didn't know
what was happening.
Yeah,
really.
Exactly.
Fear and immobilization. You were immobilized and in fear. That's how trauma gets stored. That's how trauma happens, is when you're immobilized and in fear.
Yeah.
Because we're immobilized for a hug. We're immobilized for a lot of things. We're immobilized for a kiss. We're immobilized for other things. So,
yeah.
But we're not in fear, so it's not traumatizing.
Gosh, I think about, I'm just lots of stuff in my mind, but I'm thinking about the parent who tells their kid to go give him a hug. Go give your uncle a hug or something, or whatever, your aunt a hug, and they don't want to.
Right.
I mean, that can be traumatic.
Yes.
That's
taking away agency.
Yeah.
That's no control. I'm not safe. I'm not protected.
Yeah.
Yeah.
That, I think there's so much there. And I think that's ultimately what treatments like EMDR, it's a treatment.
It's a treatment for the body. It's not, I don't do, and I talk to my clients about this all the time. I was like, well, I'm going to tell you, I don't, what you think about therapy is probably not what you're going to get in here. Because our experiences are stored in the body. If we don't get to how our body has stored those things, if we don't get to the body's processing of it, it's still there. Yeah. It's still there. True. So you have to process with the body in order to heal those places.
Yeah. That is so true. That was really eye-opening for me. And literally we just sat here for a couple of minutes. So I can only imagine, for somebody who's gone through something even more traumatic, or, and not to discredit the small trauma that people can have, but I just know that there are people who've gone through much deeper things, I feel.
Yeah, but most people don't understand how much those little traumas, they don't think of it as like, well, I had a great childhood. It's like, and you may see it that way, but there might also be, without having to point fingers at mom or dad. We have what we have in terms of tools, and we give what tools we have. Right. Just because we didn't get something doesn't mean that we didn't deserve something. It could just simply be that our parents didn't have the something to give. They just didn't know. Yeah. And it wasn't intention, but that stuff gets stored too. And so it may be more than what people think. Yeah. That affects how we think, behave, interact with other people now. It always goes back to somewhere, because people, it's so funny because they tell me what's going on now. I'm like, well, it's probably not what's going to come up, because it's going to have a seed somewhere else. If it's active now, if it's triggering now, it came from somewhere else, probably much younger. Yeah. So that's, And
real quick on that too, this is something that I learned in therapy with the things that I've gone through in my past, one thing I've learned is that sometimes when you do the best with what you have, it's not always good enough. And that's, again, not to point fingers. It's not to say,
it just is what it is.
It's just reality.
Right.
It's to say, like, you may not have everything that you needed from your experiences, and doing the best with what you have isn't always good enough. And that was really eye-opening for me. And I know that it's only once you process things, and it's only when you hear from somebody who can come from the outside and say, like, have you thought about this? Have you physically processed your emotions? That you actually discover that, and you become self-aware, and you become to grow. And I think that is, it's really underestimated. The work that goes into therapy and self-awareness is really underestimated to changing your life. I think it's so much, there's obviously stigma around mental health and in different parts of the world and everything, and I think we've made a lot of progress in that, but I think it's just underestimated to do the work that's required to really move forward from some of the things in your life.
And that's what I tell clients, is like, I can't promise you easy.
Right.
It's going to be hard, but I can promise you it's worth it.
Yeah, it really is. Just from the small amount of time that I've had with my therapist, and I'm sure you see it every day. You see it every day.
I've been through my own therapy.
Yes.
I don't practice anything that I haven't done for myself.
Yeah.
That's one of my ground rules. I think because I have a trauma history.
Okay.
And for first time I did EMDR was with another clinician. God bless her. And I knew I had a lot in there, right? I knew I had a lot of things that could be processed, because you have a practicum part when you're doing the training. Just the basic ones. I tried to pick like the easiest one I thought there would be, like, oh, well, this is not going to like traumatize her. You're working on this. So the first time I did it, and this is literally, I think we did like 20, 25 minute stints. So, I mean, this is not a long session. Okay. And we're practicing on each other, and I picked this seemingly, easy thing, innocuous thing. And I got done processing it. I got up and went to the bathroom. I'm like, something feels different. My body felt different. I just felt different. And, we finished processing, and, what we call future template and all this other stuff, finished out the end of it. And I got up, and I was like, something just is not right. Since that first time processing EMDR, my childhood asthma has been gone.
Wow.
And something I thought was seemingly simple, I guess I had been holding on since that moment. I had been holding tension in my chest and back so tightly that it was restricting my breathing, which is why inhalers didn't work, allergy meds didn't work. Nothing worked to allow me a full breath.
Wow.
Until I processed with EMDR.
Yeah.
So, I think that's the best way for me to describe how much it can change things. And I guess I don't just use the eye movement. I don't just use movement. And there's more than one way to get at the body's storing of, our negative experiences or our difficult experiences. Use flash technique, another thing that I'm trained in. Where it's kind of like, okay, I want you to bring it up and slightly activate it, but then I want you to put it over here. And then we're going to go somewhere else.
Okay.
We're going to go to something more positive. And every now and then we're going to check in with this, and we're going to kind of just tap into it, barely touch into it, and see what's changed. It'll go down from there, doing it almost like subliminally.
Wow.
So those are for people who get activated too easily, or if it's something that's a major trauma, there's a major fear about going there. We'll do that first to see if we can knock it down a little bit so it's tolerable going through a different way of doing it. And then, EMDR doesn't always, now somebody's going to get me for this, but it's true. I've seen it in my practice. EMDR doesn't always get to all of it. Okay, so that gets to what's stored in the mammalian brain and some of what's in the reptilian, but it doesn't quite get to everything in the brainstem and where the brainstem meets the spinal cord, which is where we really think that our, the imprint is at.
The
right.
deep memories.
Right.
Yeah.
The body, the deep body memories. And so then I'll use brain spotting, which is a fixed eye movement in a place where your mind has stored it in your visual field.
Yeah.
And we focus on that spot for a little while, and you'll feel it activate. You'll feel it come back down, and it's highly intuitive. Your brain knows where it needs to go. Yeah. And that's what I tell people when I'm doing it. It's like your brain knows where it needs to go. All we're doing is opening up the door and letting it walk through.
Kind of
and keeping the door open. That's it.
Yeah.
There may be parts that come up that are dissociative parts that come up to try to protect you from feeling those things. You work with those parts, and then you roll on. Yeah. It's not a straightforward. Everybody is different with what they need, which is why I'm always gaining new tools.
Yeah.
Because then I come up on something. Well, I need something more. I need something more. So there's always more than one way to get at it, but somatic experiencing is another one. Allowing your body to complete, when it got stuck and immobilized, allow it to complete some semblance of fight or flight so that what's the word I'm looking for? It's not diffuses. I mean, it does, but it gets out of the body, like it completes. Yeah. So that you're not going back there over and over again.
Closure almost.
Right. So body work. Physical
closure.
Correct.
That you never had.
Well, and to let your body know you're not there, you're here.
Yeah.
That's the other thing that is that's one of the reasons why it works is there's this dual awareness of past and present. You're not hypnotized. You're in control the entire time.
Sure.
You want to stop, throw up your hand and say, okay, I stop.
Yeah. Yeah.
We're good. And you can stop at any point. It's going to bell curve up. You're going to feel it. It's going to increase, and then it's going to come back down. What goes up comes back down. But if it gets to an intolerable place, just stop.
Yeah.
But it's like having awareness of the past and present at the same time. So you're bringing those parts of yourself that got stuck into the present to see you're not there anymore.
Yeah.
It's over.
Wow.
And your body recognizes that it's over and can then calm.
Yeah, because when you think about it, you feel like you're there. You get those sensations of that's what your body's doing. It's trying to, I think about probably times with people had adrenaline running, and they were trying to, their body was just trying to get them out of the situation, and all of that comes back up whenever you think about it, and also not even just when you directly think about it, but when you're in experiences that relate to maybe the trauma, and your body is just reacting and trying to help you, and you just have to train and say, I'm okay, and it's not happening again, and
your body's doing what it's supposed to do.
It's trying
to help you.
Yeah. Wow.
But that help then becomes problematic when you're not in that situation anymore and you're moving forward, and it's like, okay, you can stop now.
Yeah, and the last thing I think I want to ask is a two-part question. So I want to just ask I want to speak to the skeptic of EMDR, and I first want to just ask about the credibility. So
30 plus years of research.
Okay, so let's talk about that, and then I just want to talk about just the personal aspect of what you've seen with EMDR. So let's talk about the credibility. You said 30 plus years of research into this type of therapy, this type of treatment. Since it began. So this is not something that's magic. No. The average person is probably can probably have lots of questions about it. So I just want to speak to them and say, and what would you say to somebody who's skeptical of EMDR?
I was too.
Yeah.
Like I said, until I sat for that first, I'm like, whatever.
Yeah.
But I felt it myself.
Yeah.
I can't deny what I've experienced for myself and what I've seen other people experience.
Yeah.
And there's a lot of research to back it up. There's 30 years plus, since Francine Shapiro discovered it and started using it and then fine tuning it. And now we use it all over the world to help, even in acute trauma situations. EMDR, is international, and EMDR HAP, the humanitarian, part of it. They go all over the world and help people that are in the middle of natural disasters and things like that. So we know what it does.
Right.
And no, it's not magic. Like I said, sometimes I have to go back in with some brain spotting to get a little bit deeper. That's not uncommon. But when you're sitting in a place where the pain becomes not manageable anymore.
Yeah.
And you're willing to try pretty much anything. I think your skepticism kind of goes when you're ready for it. The skepticism is like, okay, whatever, but I'll try anything. And I get that. But for the skeptic, you can go online and find out for yourself. Mm-hmm. There are too many.
Do some research.
I work with combat veterans. I work with sexual abuse victims. Mm-hmm. Childhood, adulthood. I've worked with all kinds of things, fibromyalgia, all things.
Yeah.
That I can, even under the sun. But just if for nothing else, to understand yourself better, to forgive yourself for being human, to heal in that way, it's worth it. To get the awareness, just the insight that comes from, oh my gosh, that's where that came from.
Yeah. Not
knowing that something so far back could have such a profound impact on our bodies and our lives.
Yeah.
It's amazing to be free of that. And I'm never going to say, oh, you'll never have triggers again. That's crap.
Yeah.
You do.
Yeah.
But they're blips.
Yeah.
They don't take over and drive the bus anymore.
Right.
It's like, oh, I noticed that. That's what that was. Okay. Go on with your life. They don't stay, and they no longer have the control over your body and emotional responses.
Yeah. And I think that's really, powerful, is taking back the control over your life, your mm-hmm. body, your physical body, your emotional and mental health. That is the power of doing the research and saying, look, maybe this is an avenue I need to go down, mm-hmm. and maybe this is going to be helpful for the things I've gone through. And it also speaks to the being human, and we all have these things that we've experienced, whether it's on a small scale or a big scale.
Nobody escapes that.
Yeah, and that's what I mean. It's kind of something we all can share, in that this work is universal. It really does have much more to do with being a human mm-hmm. than what you've experienced. It's more about, I also think about it too, like people go to the gym and they do all this other stuff, or they go to the doctor or whatever, and it's just like, that's considered in our culture like
acceptable.
Good work. Yeah. Good work to do. Mm-hmm. Or you're working on your body 2023 like I am. Yeah. What if you did the emotional and physical work
it impacts
that's deeper?
Everything.
Yeah. And see what that can change for your life,
Right.
So let's talk recommendations of things that could help people maybe with ADHD, EMDR, or just in general. Give me just a couple of maybe your favorites in your journey that have helped you, or you would recommend to other people, whether it's a podcast, a book, a YouTube channel. It could be anything. Even just it could be a whole company or a resource for people.
And that's hard because there's so many. Like I was telling you earlier, I read probably 5 to 10 books a month.
Yeah.
And when it comes to trauma, it depends on how people are with reading. Not everybody wants to read, likes to read. Yeah. That's something that not everybody is going to do.
Okay.
So there's that.
Uh-huh.
And so I'll say, I just want you to kind of Google this and,
mm-hmm.
Kind of get a little bit more information about
mm-hmm.
it. When I start EMDR, I have 3 videos that I send with someone.
Okay.
Because I'm not always linear in the way that I explain things, and they're better at it.
Yeah.
So it's like, look, I'm going to let you watch these, and then I will answer any questions you have.
Yeah,
okay?
And Michelle sent me those, and those are helpful. So
Gotcha.
Why don't you we'll put those in the description. Okay. I want to make sure that people can find those, because they're good explainers.
There's just 3. Yeah, I had 4 in there to begin with, and this is kind of, something that I got in my second, I think my advanced training is when I got those, or maybe it was from my case consultation. I don't remember. Mm-hmm. But, 3 out of 4 of those, the 4th one was not really worth putting in there. So, yeah.
Okay. So those videos will be helpful as far as the EMDR. Is there
mm-hmm.
anything maybe in the ADHD realm that you would recommend a book, a podcast?
For ADHD, recently, the ADHD effect on marriage is a really good one.
Okay.
Because I think that it does play a part in our relationships. We talked about the dynamics of living with multiple people that have ADHD in the household, but it's different with a partner.
Yeah.
And becomes problematic when the non-ADHD partner starts to try to parent, to try to control some of the symptoms, especially with someone who hasn't been, this is more for people who haven't been diagnosed yet or who are newly diagnosed.
Okay. Yeah.
Okay. To understand what part it's played, because I think that the negative cycles that happen, can be around symptoms. It's just symptom management. It's like the symptom, the reaction from the partner, then the reaction from, to the partner's reaction that gets you caught in the negative cycle. Right. And then you're looking at that person as being, the intent and all that other stuff. And it can build resentment and not so great things. So that's a good way of seeing, how does it play a role? How can you shift how you see each other.
Yeah.
So that's a good one. I have so many, I follow some really good people on Instagram for ADHD. Okay. And right now I can't think off the top of my head. I'll have to
you can
I'll
send
have to send you that stuff. But yeah, that's for ADHD. And then for trauma in general, the body keeps the score is like the Bible of trauma.
Okay.
It's not easy to read. It's thick. But it's well worth the read if you really want to understand why you experience what you experience, to make sense of your world, as someone who's survived trauma. That's a great one. Yeah. It didn't start with you. To understand, that's another book, to understand generational trauma, how trauma didn't start with you, didn't start with your parents. It can't have. Yeah. So it's looking at generational trauma and how to see people as human beings and how we got to this place is another one. Okay. That's really pretty good. I'm trying to think of other things, and I think I was telling you earlier, I've been working with and enjoying working with females on the autism spectrum, what we call high functioning females on the autism spectrum, because they're overlooked so much and because it's so difficult for them to find the diagnoses because the research just hasn't been there for females. It's been based on male presentation.
Wow.
Spectrum women, for anybody who is, because they're so often self-diagnosed first.
Yeah.
And not caught until they're adults. So if anybody's thinking about possibly being on the spectrum and as a female, that's a good read. It's phenomenal. It's a bunch of
what was that one again?
Spectrum Women.
Yeah, Spectrum Women.
And there's the woman who wrote that and took the experiences of 14 women on the spectrum and shared their experiences. And
really?
Yeah. So it's pretty great to hear how it presents so differently.
Yeah.
And all these different people experience, autism differently.
Mm-hmm.
They present differently. So it's not, autism isn't this one thing any more than ADHD is this one thing.
Right.
So finding, those kind of resources that help you not feel alone in the world.
Yeah. That is powerful, just to know that people have the same experiences that you, if not exactly the same, similar, mm-hmm. and they can find common things that have helped and common things that can help you move forward from some of it. Mm-hmm. So I want to get to a couple fun questions and then we'll wrap up. I ask most of these to everybody. So I like to get kind of those similar, questions, but get the different answers from all the providers. This is more going back to getting to know our providers.
Oh, okay.
And so first one is, what occupation other than your own would you like to try? Or would you have had you not gotten into this? So I think I know the answer, but maybe you have a different one.
If I had to do something else that I think would be would provide enough dopamine hits for my brain
for the ADHD
that changes enough, something different all the time. I like working with my hands, so I think building houses or building and flipping houses probably would be something that I would do if I, had to go with something different. and not in the same realm.
Yeah.
I think a lot of us that have ADHD, we do pretty well working with our hands.
Yeah.
But that would be something that would always be changing, something new, something creative all the time.
Yeah.
So I think that might be it.
That's a good answer. I would not have thought about that as well. But the building with your hands, I'm sure that's why art is a great thing. I talked with Katie Irwine about art therapy and all the things that she's helping her clients with, and I think that's a really constructive way to focus. So okay, what would your last meal entail? And this can be anything, and you don't have to eat all of it. You could have like a couple things. So just maybe some of your favorite foods that you would have at your last meal.
Butter, and more butter.
Okay.
So like prime rib with crusties on the outside, medium rare, lobster tails with butter, rolls with butter, broccoli with butter, charcuterie board. So high fat.
Yeah. What are you drinking? Are you a wine person? Do you like any sodas? What are you drinking at the meal?
Probably, it's so funny because my family, we don't drink a lot while we're eating.
Okay.
And that's just how I grew up. Huh. So I don't think it would really matter.
Okay.
I'd go with water.
With water.
Because I usually don't drink when I'm eating.
Maybe throw some lemon in there or something. And just.
Yeah. Okay.
Very interesting. If you were an ice cream flavor, what would you be?
Everything but the kitchen sink.
Okay. So what?
Whatever
like
has
the cookie,
like everything, like just anything and everything just thrown in there.
Okay, because I know Panera has a cookie that's everything but the kitchen sink.
I didn't know that.
And it's like it has a certain stuff. It's like pretzel pieces and all that stuff. But okay,
as long as it has a whole bunch of like everything.
Okay, you like the chunks in there.
Yeah.
Okay. Cool.
Yeah. Just a variety.
Just a good variety.
Keep it interesting. Every bite's different.
And then, what are some of your favorite movies or TV shows? What are you into? Maybe lately.
I just finished his Dark Materials. I tend to veer toward, sci-fi fantasy.
Okay.
It helps. It's creative. It's imaginative. Something that sparks the imagination, where I can unplug and just suspend disbelief and go there. I don't do rom-coms and stuff. Like, I'm not interested in that. I want something that really sparks the imagination.
Yeah.
Something that grabs, again, probably dopamine hit.
Yep.
But I also love historical dramas.
Okay.
And I think, again, that's a suspension of disbelief. That's somewhere where your imagination has to create something new.
Yeah.
That you don't have the scaffolding for, or the frame of reference for.
Okay.
So it forces your brain to get a little bit more creative, to accept, and to be in and immersed in those things.
What's maybe one or two? Yeah, is there
Dude,
one that you like?
I love Masterpiece Theater. I'm PBS Masterpiece Theater for my historical dramas. I just finished up Scarlet and the Duke.
Okay.
That new episode.
And what about the sci-fi too?
Sci-fi, like Stranger Things.
Okay, yeah.
I love Stranger Things. Fifth Element is one of my favorite movies, as hard as that is.
Cool.
I can't say that I think Willow, this new series, is great. I think they could have done better.
Okay.
But, Marvel, like I said, his Dark Materials, I just finished up, and I loved that.
Cool.
So it's just a different world.
Cool. Well, that is really awesome. I appreciate your time. Thank you so much for taking some time to talk with us. I know you have a busy schedule where you don't really have many slots, but if someone wants to get on the wait list or talk with you, just call the office and they can get in.
I never know what I'm going to have. Honestly, I get in and I'm like, I don't know what I have today, but we're rolling with whatever's on my schedule.
And you love it,
I do.
And you're getting it, and you're just like, roll with
something
it.
different every day.
Yeah. Cool. Well, thank you so much. I appreciate it. And we'll see you next time.
All right.